For the 11th time this month, and we'll remind you today is the 17th, the U.S. has once again shattered its record of new coronavirus infections. Yesterday, the country topped a previous high for new cases set just 2 days ago by nearly 10,000. It topped a previous high for new cases set just 2 days ago by nearly 10,000, bringing the total to more than 3.5 million since the pandemic reached our shores. And the number of deaths is sharply rising too. As of Thursday evening, the country has lost more than 900 lives. 10 states, including Florida, Texas, and South Carolina, all set new record highs for fatalities in a single day this week. Doctors and experts continue to warn hospitals could soon reach a breaking point and send the United States into a spiraling public health crisis. CBSC's Naomi Ruchim reports.
Georgia Governor Brian Kemp avoided questions about his executive order banning local mask mandates.
It's a simple thing to do.
Kemp is now suing to stop Atlanta Mayor Keisha Lance Bottoms from requiring masks in her city.
I am not afraid of the city being sued, and I'll put our policies up against anyone's any day of the week.
Other Georgia mayors are also refusing to back down.
Our emergency declaration still stands.
More than half of all states have mask requirements. Arkansas and Colorado became the latest yesterday.
The whole country is showing a significant uptick, and Colorado has not been an exception.
Southern states are being hit particularly hard.
It doesn't stop, and we don't know when it's going to stop at this point.
Florida reported 156 new deaths yesterday, a record high. Miami Mayor Francis Suarez says he's talking to businesses about a potential lockdown.
If something is not done to dramatically alter our course, we could be in a more dire situation than what we're in.
Texas also saw a one-day high for deaths, 129.
These individuals are our family members.
In San Antonio, refrigerated trucks are on standby in case morgue space reaches capacity.
This is a morbid topic, but it really does underscore the severity of COVID-19 in our community.
South Carolina reported 69 new deaths yesterday, also a new record. Naomi Ruchim, CBS News.
So Dr. Bob Lahita has been following all the latest developments from New Jersey. And Doctor, you join us now. We are hearing now that the U.S. health officials said, that they have issued guidance on reducing what they're calling unnecessary testing for COVID-19. Of course, earlier this week, we reported that the administration had ordered hospitals to no longer be providing their data to the CDC, but instead redirecting it to the Trump administration, to the Health and Human Services Department. When I heard the phrase unnecessary testing, I just thought of all the people that I know that have gotten tested. They usually have symptoms, or they know they've been exposed to somebody who tested positive, or they're frontline workers, and so they're being exposed to, hundreds and thousands of people daily, and so they're getting tested. Most people don't get tested just for the heck of it. It's not exactly a pleasant experience. So I want to get your take on this phrase, this idea of unnecessary testing, and talk to us about the importance of widespread testing, how that gives us an accurate look at just how prevalent the virus is.
Yes, it's very important, first of all, to test people for tracking purposes. But people who have been home and quarantined, Anne-Marie, for 14 days or 2 weeks, they don't need to be tested after their disease becomes quiescent. It's already a given that they've had COVID-19. So a lot of people are doing that. They're being tested 2 and 3 times, and it's not a good thing. And as have you heard that in Florida, Texas, Louisiana, and some of our southern states where the disease is out of control right now, they're running out of reagents. And reagents are those chemicals that are needed to do the tests. So the wait time, and this we had in New York and New Jersey some months ago, the wait time can be as long as 2 weeks for a result. And if you're in the hospital and the hospital's overrun with cases, especially people on vents and in the ICU, the reagents run low and you can't get results back. And the doctors don't know who's positive and who's negative. That is a big issue. Fortunately, in the Northeast, we don't have that anymore, but we did have that at one point. And I certainly can appreciate the problem. Now, obviously, what's going to be important going forward is what's called point-of-care testing. Point-of-care testing is going to be rolled out. There's about 100,000 of them, I'm told, from Washington that are going to be rolled out so that you can be tested and get the result within 15 minutes. But again, those should be reserved for healthcare workers, people in high-risk positions like paramedics, EMTs, bus drivers, subway conductors, etc.
Dr. Bob, let me ask you about an LA Times article that suggests that scientists have figured out that if you use antibody-rich blood plasma from COVID-19 patients and you inject that into an upper arm area of an individual, that could prevent the coronavirus. It's been used before, as you probably know, in prevention of hepatitis A. Dr. Fauci has called it an attractive proposal, but the LA Times says, according to their investigation, the federal government and even pharmaceutical companies are refusing to act on the principle. So can you explain why this plasma-rich blood using the antibodies of somebody who has survived COVID-19 could be injected into a person who hasn't had it to prevent them from getting it, and why you think that the federal government and pharmaceutical companies might not be interested in seeing this produced on a wide-scale level?
Yeah, Vlad, that's a great topic. We, as you may know, have research around the country for convalescent sera. That means sera, or the non-cellular part of the blood that is removed from your body. After the cells are removed, that plasma contains huge amounts of antibody directed against the coronavirus. So that can be purified, it can be condensed down, and it can be given back to people that have acute infection. And people who are near death will benefit, hypothetically, from injection of these antibodies. Now, the kicker here is that it is currently only for hospital IV administration. And what you've heard from Dr. Fauci and others is that this can be given intramuscularly as a concentrated anti-coronavirus, not vaccine, but an injection. We call that hyperimmunoglobulin, or immunoglobulin, which is referring to the protein that's in the blood of these patients who have suffered this infection. Their immune systems have made tremendous amount of antibody. That antibody can be purified and injected into people. Now, the only thing right now, though, is we can give it IV. We can't give it IM. As you know, for rabies, for hepatitis, as you've mentioned, for chickenpox, we can give this hyperimmunoglobulin to mitigate and prevent severe infection. And the question is, why aren't we doing that now? And what the answers are, kind of disturbing actually, is that it's a financial issue, that companies are not willing to put a lot of investment into immunoglobulins of this nature if a vaccine is right around the corner, maybe 5 months. But nevertheless, it's an investment to ultra purify immunoglobulins or antibody from infected people to give to healthy people or people recently infected. So it's an economical deal right now, which really is unethical in many, many ways. But I think that's the reason we're not seeing it out there.
Doctors, we're learning more and more about the virus every day, and there's increasing evidence that shows that people who contract the virus, even if their symptoms are mild or moderate, may have long-term side effects. What are we learning about sort of the lingering effects of COVID-19?
Yeah, that's a very good, Anne-Marie, that's a very important question, because you hear young people talk about, well, I'll get infected. It's sort of like a mild case of the flu. Not so. There are lingering effects for many people who recover, who never make it to the hospital, but they are short of breath and can't walk. We have a thing we call in medicine the 6-minute walk test, which measures your ability to breathe and walk and expend energy. That 6-minute walk test in people who have had this virus, in many people, a good percentage, is decreased. Their thought processes, foggy brain, becomes an issue, and that's post-infectious. Loss of smell, loss of taste, loss of hair, problems seeing, extreme exhaustion. That's probably the most common complaint I'm hearing from patients. I have a lot of patients who have not been in the ICU, but were in the hospital and are now wearing oxygen. They carry an oxygen tank with them. They're 2 and 3 months out, and we're not talking about old people. And the most scary thing is having a stroke or clotting a blood vessel in your arm or leg and actually losing the arm or the leg. We've seen patients have that, and we've heard of many patients, one of which is very prominent in the news last week. So it's not that you get the infection and you recover. There are side effects that can be endured by many people with these infections. And so we have to realize that. And so people should wear the masks like we're telling them and keep their social distancing. This is not a mild case of the flu. It's not your grandfather's influenza. Anne-Marie?
Really interesting. Dr. Bob Lahita, thank you.
It is.
Yeah, sorry, Anne-Marie.
Well, I wanted to ask Bob just about one more thing about sort of vaccine development that you brought it up. Some promising new developments of a vaccine. Researchers at Oxford University say that their booster shot may be able to provide double protection against COVID-19. What can you tell us about that?
Yes. Well, you know, the Oxford vaccine was one of the earliest, and that's because they were looking at common cold-inducing coronavirus, not the COVID-19. They had a clinical trial in chimpanzees looking at the coronavirus many, many months ago, last year, actually, in 2019. And they were ahead of the game. So they are noting now that they have seen significant protection of chimpanzees. The vaccine that they've developed not only produces antibodies, but produces those much needed T lymphocytes. Those are cells that are part of the immune system that are extremely important to combating viral infections and bacterial infections for that matter. But for this particular COVID-19 virus, this is a very, very effective immune response that they're seeing. So the helper T cells and the killer T cells, specifically the killer T cells, which are strictly antiviral for the most part, they are being produced by this AstraZeneca United Kingdom vaccine. And they're telling me that they can have this vaccine out by the end of September, which is very, very hopeful to all of us. I just hope that people are not going to be frightened to have the vaccination as they are for the flu, for example. And this is not a good idea. So when it comes out, everybody line up and get your virus vaccine and also get your influenza vaccine for this winter.
All right, all good advice. We covered a lot of ground. Dr. Bob Lahita, thank you so much.
Thank you, Anne-Marie. Thank you, Vlad.